Hi, I'm Dr. William Song from Omni Aesthetics. I want to talk to you today about our outpatient liposuction. Liposuction has come a long way since when I was in medical school. Back then, liposuction was a brutal procedure which had to be done in the hospital in an operating room under general anesthesia. That has completely changed now. With the technology that we have available today, we can perform procedures in the office in an outpatient setting very safely and with better results than you can get with traditional liposuction. Now, I want to talk to you about how we do liposuction at Omni Aesthetics and how we are able to get such great results without having to put people under general anesthesia, without having to bring you into the hospital to do the treatment. We can do it right in our outpatient procedure room where you are going to be fully awake and we don't have to knock you out. This makes it much safer. And on top of that, we can get much better results than the liposuction that's performed in the hospital. This is the machine that changed the whole ball game. This is the Smart Lipo machine made by Sonosure Lasers. And this machine was first introduced when it was FDA cleared in 2006. And what this did was this machine was able to take that liposuction out of the hospital and into the doctor's office. And the way that we could do that was because this is a laser, and using a laser to pre-melt the fat before sucking it out allows us to use much smaller instruments. So that means instead of using big cannulas with sharp edges to cut the fat out, we are melting the fat and just sucking it out. And that makes this a much safer and easier procedure. And on top of that, it allows us to get much better results than you can get with the traditional liposuction. As revolutionary as the Smart Lipo was, it's now become old technology. We have so much better equipment now, even better than the laser-assisted liposuction that we used to do 10 years ago. So now, my favorite device for performing liposuction is the Vaser Lipo. So Vaser is not a laser, it is ultrasound. And what we do is we use sound waves to break up the fat instead of a laser. So Vaser is actually not that new. It was FDA cleared in 2011, almost 10 years ago. So why is this such a big deal now? Well, it's gotten really popular now because doctors have discovered that by using the Vaser Lipo, we can do a lot of things that we could not do with the laser-assisted liposuction. First of all, because it's using sound waves instead of a laser, it's not burning the fat, it is actually causing the fat cells to be disrupted, and it's taking those clumps of fat and kind of liquefying it, but the fat cells are still intact because it is still gentle. So we can take that fat and we can use it for fat grafting. And with the Vaser, we can actually sculpt the fat. So we can take the Vaser probe and etch the fat under the skin to actually create definition around the muscles. So we can give you cuts that look like you've been at the gym working your butt off, when in reality you just had a simple procedure in the office. So the Vaser Lipo has really taken outpatient liposuction to the next level, because now not only can we do it safer, not only can we get better results than traditional liposuction, we can actually sculpt with this thing. And this is what I'm really loving about this machine. We're having a lot of fun with the Vaser. And here's another fun little device that we're using. This is called Renuvion, and it used to be called J Plasma. So if you do a search on the internet for J Plasma or Renuvion, you'll find out what this does. But I'll tell you right now why I love this machine so much. This is a skin tightening device. So this device allows us to tighten the skin after we do the liposuction. It uses radio frequency energy combined with helium gas to create helium plasma. Plasma is a fourth state of matter, and the plasma gets really hot, but then almost instantly cools off so that you can cause skin tightening to occur in a safe way without the risk of burns that the laser can sometimes pose. And it actually creates a much better skin tightening than the laser did. So we are now able to do liposuction on people with more significant fat because we can tighten the skin and not leave them looking like a deflated balloon when we remove the fat. Because if you have a lot of fat that needs to be removed, the problem is that the skin might not tighten enough to match the amount of fat that you remove. So by using this device, we're able to perform liposuction on people that we would normally have had to send out for a tummy tuck, which is a major surgery. So, so this really allows us to take liposuction and make it comparable and a lot of times even better than surgery. Oh, and here, this could be your best friend during liposuction. Because we're doing the liposuction with you awake, we want to do something to take the edge off, but we don't want to put you to sleep because we want you to participate. We want to talk to you while we're doing the procedure, and most people are having a conversation with us, and you know, their mind is not even on what we're doing to them. So this little device called Pronox can help because this is nitrous oxide, laughing gas. And unlike the laughing gas that you might be familiar with from the dentist, this is a mixture of nitrous oxide and oxygen. So, so we're not knocking you out. We're just kind of taking the edge off so that you, so you're still awake and still able to talk to us, but you kind of feel like you have had a few cocktails and you're just enjoying yourself while we're doing this. And the best part is that the nitrous oxide is out of your system in 5 minutes. So you just take a puff whenever you feel you need it. And if you don't need it, you don't have to take it. But when you stop taking it, it's out of your system in 5 minutes. So you don't have to lay around for hours trying to recover from anesthesia. We still don't want you to drive home, but you're certainly going to be walking out of here. We're not carrying you out in a wheelchair because this stuff is out of your system. So this is another little tool that we have that makes the liposuction in the outpatient setting a much more pleasurable experience for you. And here is what a tummy tuck scar looks like on the left. Okay, so we used to send a lot of people out to get tummy tucks because we felt that we just couldn't get enough skin tightening to give them a good look with the liposuction if they were a little bit bigger. And if somebody wanted a really taut stomach, like really tight to the point you can bounce a quarter off of, you can do that with a tummy tuck because you're actually cutting out a big section of skin and sewing it together, and you're pulling down the skin to the point where you remove the belly button and you have to make a new one. The problem is that sometimes you're left with a big scar And a lot of times the belly button does not look natural. It looks like a fake belly button because it is. And also you get this boxy look. The surgery where you're just pulling the skin down isn't going to shape the body. So it's going to look kind of square. So although it's flat, there's no curves. And that's a difference. For the right candidate, we can do liposuction instead of surgery. And a lot of times we can get a tight stomach as if you had a tummy tuck. Obviously, you can't do it if somebody has a lot of fat, but we're doing liposuction now on people who don't even have a lot of fat. They just want better shape. They want a flat belly. And the scars are almost invisible. The incision sites are about half a centimeter, and they heal very rapidly. We don't even need to put stitches in there. And we put them under the bikini line or in the belly button, behind the bra, areas where they're not visible. So you don't have to worry about having these big embarrassing scars. So that's what we can do with liposuction versus a tummy tuck. But again, the liposuction is not going to give you, depending on what your body looked like to begin with, may not give you the tight, taut stomach that a surgery would do, but this is going to be a much, much safer treatment. And a lot of times we're going to get better results. And of course, we want to tell you about the other options that you have. So I just told you about the option of surgery. The other option that you have is to do a non-invasive body sculpting treatment. And of the non-invasive treatments, by far, hands down, the best treatment for reducing fat permanently without doing any kind of invasive treatment is the cool sculpting. And this is a treatment where we actually freeze the fat, and then we break the fat cells apart by either doing a vigorous massage or using an acoustic wave machine. And this is an effective way to reduce fat, and it does remove the fat permanently, and it is non-invasive. So, so this is something that people really love because it's not invasive. And here you see that we have 2 machines so that people can get the treatment done even faster. Now, the way this works is if you look at these applicators, each applicator is considered a cycle, and it takes about 40 minutes to do a cycle. And that's from start to finish. The actual treatment time is less. But the more cycles that you do, the more fat that you can remove. But if you have a lot of fat to remove, it might actually be more cost effective for you to just go ahead and do liposuction because it does take a lot of treatments with the cool sculpting to remove large volumes of fat. And that's why we have 2 machines going at the same time. Now, there are other devices that are non-invasive ways to remove fat. And the other one is sculpture, and that uses a laser to remove the fat non-invasively. And we have that too. But the sculpture is not as popular as the cool sculpting. In fact, our sculpture machine is not really being used because people would much rather have the cool sculpting because the sculpture is painful, and the cool sculpting generally it has very minimal discomfort. So this is another option. The disadvantage is that it does take a lot of treatments. It can cost more than liposuction if you need to do a lot. And we can't, although we can do some shaping with it, we can't do the contours and the etching, high definition type of stuff that we can do with our Vaser liposuction. So, so I would say maybe about 20% of people who get cool sculpting end up having liposuction, not because the cool sculpting didn't work, but because people see the results and then they decide, you know what, I'm gonna go ahead and get even better results. And that's what it does, these things motivate you to take even better care of yourself. So cool sculpting is another option that you can consider. So now let's talk about what we do here at Omni Aesthetics, how we do our outpatient liposuction, and how it's different from the way most people do it, and what I'm going to tell you what our secrets are of why we get such better results than most people with the liposuction, and better recovery too. So tumescent anesthesia. This is really the key. Besides the laser and the technology that we have, tumescent anesthesia is a way that we can numb you so that you won't have discomfort during the procedure without doing general anesthesia. And what we do is we put the numbing solution, we typically use lidocaine, and we add some sodium bicarbonate, which helps to buffer the solution so it doesn't burn when it goes in. And we put some epinephrine, which constricts the blood vessels so that there's no bleeding when we do the procedure. So what we do is we make a little tiny incision, less than about 1/2 centimeter, and we insert a little probe into the hole. But first we numb the skin, of course, before we make the little incision, so that we're all about not causing you any pain. And then we stick a little probe in and start infusing this numbing fluid. When we infuse the numbing fluid into the fatty tissue, it kind of disperses within the fat and starts to numb the tissue. And as it numbs, we can advance it further and continue to put that numbing solution into the fat that we're going to be removing. And once the numbing sets in, you really should not feel any pain. It should not be a sharp pain. You may feel some pushing and pulling, and maybe some pinching, because we're going to be pinching to see how much fat's left. But tumescent anesthesia allows us to do liposuction without putting you under, because we can numb you up with this solution. And this also makes the liposuction safer, especially if you're using energy devices. The liquid from the numbing solution protects the skin from burns that could occur with laser, and even Vaser, if you're not careful, can cause burns. So the tumescent fluid can protect you. It'll numb you, and it'll make you nice and comfortable so that we can do the procedure. And this was my secret weapon for a while before I decided to share this with others. So now there are other people doing this, and the people that I've shown are really loving it, because this makes that tumescent anesthesia even better. It's significantly better, in fact. This is our acoustic wave device, and this is a sound wave machine, and we use this device to send sound waves through the tissue. So after we put the numbing solution in, we use this on the surface from the outside, and we can cause that numbing fluid to get really dispersed into the tissue. We're gonna use those sound waves to make sure that the anesthesia is evenly distributed, so that there's no pockets where the numbing solution didn't go, where you might be able to feel a pinch. And this makes the whole procedure even more comfortable. And with this, a lot of people don't even use the Pronox. They said they feel no pain. So this is how we use the acoustic wave machine from outside. So this is an external treatment, it does not go inside. And basically we're going over the area where we put the numbing solution, and we're using those sound waves to spread it out. And this makes the treatment go much easier with very little discomfort. Here on the left is the ultrasonic Vaser probe. So these have little ridges, but it's a solid cannula, and notice that it's blunt. And what it's doing, it's vibrating at very high ultrasonic speeds. And you can't even see the vibration because it's very fast. But what it's doing, it's breaking up the fat. It's breaking up the lobules of fat and actually releasing individual fat cells. And then on the right, you see our suction cannula. So after we break up the fat, we use a suction cannula, which is a lot thinner than the cannulas that we used to use to do liposuction the traditional way, where the hole might be in the front with a sharp edge where we're pouring out actual tubes of fat. Here, we don't need to cut anything because the Vaser, the ultrasound, has already broken up the fat, and we just suck those fat cells out through these little holes on the side of the cannula. So we're not using any sharp instruments inside your body. That makes this so much safer because we don't have to worry about puncturing anything. And in fact, we're staying in the fat layer under the skin, and then there's a fascia layer and a muscle before we can get into your intestines. So there's really no risk of puncturing any intestines or anything like that, unless there's a hernia. And even if there's a hernia, because this is blunt, it's unlikely to cause any punctures. But of course, we are going to check before we schedule you. We're gonna make sure you don't have hernias or anything like that, because we want to make sure that everything is done very safely. And this ultrasound Vaser treatment with the smaller cannulas really makes this treatment much safer than the way it used to be done. And after we're finished sucking out the fat, we go ahead and use that acoustic wave again. Like I said, this is a really neat treatment, because what we can do now after we've sucked the fat out is we can use this to kind of smooth everything out, okay? Because some of the remaining fat may be unevenly distributed, causing you to have some unevenness on the skin surface. So by using this applicator, this acoustic wave, after we do the liposuction, we can actually make the results much smoother and even help with some cellulite. And now I'm going to show you some results that we can get with using these techniques. And remember, this is all done as an outpatient, which means you're fully awake, and we're using Tumescent anesthesia. And if you look at this picture on the left, this man is a former bodybuilder, and he still works out, but he's older now. And you can see that he's developed what's called gynecomastia, which is a man with some breast tissue. So with the Vaser liposuction and the Renuvion skin tightening, we can actually get rid of the fat in the breast tissue of men and make it flatter, make it look much more masculine and muscular. And we can remove that fat, the fat on the side here, and we can also remove all this fat in the front. Now, if you notice, he does have a little bit of skin here that's left over. Okay, so because he is a little bit older now, his skin didn't retract as completely as some younger people might. But the way that we can treat this is we can go back in and do some more skin tightening, or if we can just surgically remove this little piece of skin without having to do a full tummy tuck, or we can just leave it alone. And in this case, he was just happy with the results. He didn't care about this little skin that's left over. So we decided to just leave it alone for now. And he looks great, and he's very happy with his treatment. Here's a gentleman who is a little bit younger. So his skin was able to retract very nicely with the treatment so that he did not have any skin left hanging over. And we were able to actually show some definition. We can show a little bit of definition, and this was done a few years ago. And we've gotten a lot more aggressive with the contouring and high definition. So now we can do even more refined definition. But here you can see that whereas his stomach was just kind of fat and out of shape, we can suck out the fat in a way that it looks like he's in much better shape with some cuts and grooves so that he can show it off. And if you look at this picture, it looks like it's a different person because he's tan on the right and he's let some of his hair grow in. But if you look at the pattern of moles on his stomach, you can actually tell that this is, in fact, the same person. And this is years later, and he's still looking great, and he's motivated by this to stay in shape. So that's what we're finding a lot when we do this treatment. Initially, when I started doing liposuction, I was afraid that people would get liposuction and then let themselves go. But I find the opposite is happening when they start to see how good that they can look. They start changing their lifestyle and actually start looking even better because now he's exercising more than he used to. With traditional liposuction, we would never have tried to touch a person like this because she has so little fat that if we tried to remove that fat with the big cutting cannulas, we would actually leave grooves and ridges and make it look worse because she looks really good even beforehand. But with the very sophisticated instruments that we have and with the ability to sculpt with the Vaser ultrasound, we were able to remove even more fat from her and give her that real flat belly that she was looking for, and also remove some of this extra fat from the sides. And you can actually see some of her ribs kind of showing through because we were able to really remove that fat and get nice, smooth results using the techniques that I described. Here's another patient who has had several children, and she's had some surgeries. She's had some laparoscopic surgeries, which sometimes can make liposuction difficult because there could be scar tissue and fibrous tissue that makes it difficult to go through. And you can see she's got some loose skin there on the left. And this is, again, somebody we probably wouldn't have treated with traditional liposuction. In fact, I know we would not have attempted to treat that. But with the instruments that we have now, what she really wanted was to allow her abdominal muscles to show through because she works out like crazy. And as much as she works out, her abdomen did not look as good as she should for the amount of working out she does because she's got some loose skin and a little bit of fat. And what we were able to do was to remove some of that extra fat and tighten the skin and contour it. So now her abdominal muscles are showing through and you can see that six-pack. And now she can go to the beach and show off her muscles. And other than the previous surgical scar she has, she does not have a big tummy tuck scar that would occur if she had surgery. And the surgery would not give her the definition that we can give her with this Vaser liposuction. Here's another patient who wanted to show off her abdominal muscles that she has underneath the little bit of baby fat that she has. And we're getting a lot more, we're getting more and more of these type of patients, people who would really not have been candidates for liposuction in the past. but we're now doing the more high-def liposuction, and we're able to give people that flat belly. And again, she's in pretty good shape to begin with, so we can do that. Somebody who has a lot of fat, we're not going to be able to get this type of results, but we can still get some very nice improvement in people that have extra fat. Another very happy client, and this is a picture that she sent us. She sent us this selfie that she made and posted to her own social media. And we love when people do that, and we love to see our happy clients. This is a patient who has a little more significant amount of fat. She wanted a better shape, and she wanted that belly to be flatter. So here you can see that she's had some laparoscopic surgery, which they went in through her belly button. So her belly button's a little bit misshapen because of her surgeries in the past, but we were able to just go in through the same opening, and also from underneath her bikini line where you can't really see any scars on her. But even a patient like this who's had previous surgeries, which again makes liposuction very difficult with the traditional methods, but with our Vaser liposuction and the Renuvion skin tightening, even a person like this, we can get very nice results on. Not only are we removing fat from the stomach, we're also removing fat from the flanks, and we can actually do what we call a lipo 360, where we do the fat removal all the way around, and this way we can get really nice results, give you a waistline that you may not have had before. We can remove some of that fat hanging from underneath the bra line, get rid of those folds that many people have under the bra line. And in this patient, we didn't do it, but what we can also do is we can take some of that fat and inject it into the buttocks to give to plump out the buttocks and give you the shape that a lot of people are looking for these days, and that's called the Brazilian butt lift. And I'm just showing you a variety of different results. Here again is another older man who wanted to look like he did when he was younger and working out. And we were able to remove that extra fat that he had around his belly, and then make some definition. We can actually create some grooves to show the hint of his muscles that he has underneath. And again, this is all done as an outpatient with no general anesthesia, with our Vaser liposuction and the Renuvion skin tightening. This patient had a significant amount of fat, and this is what I was talking about before. This is a type of patient that in the past, if she really wanted to have a flat stomach, we would have had to send her out to get a tummy tuck, because if we tried to remove the fat with traditional liposuction, we would just deflate her like a balloon, and then she would have a flap of skin hanging in where the fat was. So now with our tools that we have with the ultrasonic fat disruption, where we can break up that fat and remove it, and then the Renuvion skin tightening, we can tighten that skin so that even a patient like this, we can give her a very flat look, much flatter looking stomach. And now because this patient is older and because she had more fat and she's not somebody who is actively working out, we can't really give her that high definition six-pack type of abdomen, which really would be unrealistic on a patient like this. But we are able to cause significant flattening of her belly, and this is without major surgery. This little mark underneath, that's not a scar. That's just from her garment that she was wearing. Another patient here with a significant amount of fat, another tummy tuck candidate. So again, this patient in the past would have had to get a tummy tuck to get good results, but with our tools that we have now, we can get a very nice reduction of that fat that she has. And you can see that she still has some fat and flabby areas that we can go ahead and do a second procedure and get that to look even better. And the reason why someone like this, we would need to do a second procedure is because doing this as an outpatient, we don't want to remove too much fat in one setting, and because we are limited in how much numbing that we can use to do this safely and how much fluid shifting. So we remove the safe amount of fat. And also, if we remove too much fat at once, there's only, even with the great tools we have, there's only so much skin tightening that we can do. So we don't want to take out the fat and leave her with that extra skin. So we like to do the first session and see how she responds, how well her skin tightens, and we can see that her skin tightened around the area very nicely. So now with a patient like this, we can go ahead and do a second procedure and give her results that are almost as good as some of the people who didn't start out with so much fat. So we do other areas of the body, and the thighs are a very common area to do. So in this patient, she had some saddlebags that we were able to remove, and we were able to soften some of the cellulite. Now, cellulite is a very difficult thing to treat. We still don't have a great treatment for cellulite, but in the past, we used to tell people that doing liposuction can actually make your cellulite worse. So with the techniques that we have, with the Vaser and the Renuvion and the acoustic wave, we still haven't been able to find the perfect way to treat the cellulite, but we can make it better. We can make it better with our liposuction and these tools that we have, whereas in the past, doing liposuction on somebody with some cellulite could actually make it worse. So we are continuously finding ways to go after that cellulite as well as the fat. The upper arm fat, or some people call these bat wings, this is another area that we can treat. If we're not careful with this, we can leave a flap of skin, whereas you had kind of a fat flap hanging over. And if you remove too much fat there, you might be left with a flap of skin where the fat was. And sometimes that can look even worse. So we do have to be kind of conservative with the amount of fat that we remove from this area. But as you can see in this picture, we can make that look a lot better than it was. As long as we don't try to be too aggressive with this, we can get some very nice, natural-looking results. And here's a patient. We did the Lipo 360. We took the fat from her stomach and her waist, and we transferred it into her buttocks. So you can see it's fuller and projecting out, and looks a lot more defined. Not that it was that bad looking to begin with, but you'll notice that with my procedures, I don't like to make it too big, okay? And that's just, as a doctor and an artist, it has to look right to me, okay? So this looks good. But I do have patients that want significantly bigger buttocks, and I just can't see that as looking normal in my mind. So I don't do those. And also, when you put large volumes in the buttocks, there are some safety issues that we have to be concerned about, because putting large volumes in the buttocks has led to complications, including fatalities and infections, in places like Florida, where they do that procedure like an assembly line. And that's because um, they're actually using power devices to inject the fat quickly. And then sometimes they will inject the fat into a blood vessel and cause an embolism. Um, and, uh, and putting those large volumes in can create an area where infection can occur. So I like to do it very modestly, and we do it very carefully, and I do it manually, and I don't like to put very large volumes in. And when we do it that way, we can do this very safely. So if you're looking for, and this is kind of a modified Brazilian butt lift because it's not as big as um, you would get down in Florida, but our patients up here in the Northeast aren't necessarily looking for that. So, so this is a treatment that we do, and our clients are very happy with it. We can inject fat into the breast. So this is a great area for fat grafting because the breast tissue is naturally fatty, and putting some fat into the tissue there can actually stimulate the natural fat to enlarge. And we're not going to get the anti-gravity effect that you can get with the silicone implants, but we can get a nice natural fullness that doesn't look fake and doesn't feel fake. And this is a great procedure, and this is something that that is getting much more popular as people are realizing that artificial implants may not be the safest thing to have in your body. Again, it's not going to give you the huge breasts that stand up, but you can get a natural increase in size, and we can improve the cleavage line, and we can even improve the skin in the décolletage area with the fat transfer. So this is a great treatment. And here it is. This is the grand finale. This is my favorite treatment, and this is what we're really known for, is our fat transfer to the face. So even before I started doing liposuction, I was using fat instead of fillers. I mean, we still do fillers, but fat is such a great way to naturally restore the volume loss in your face, because the volume loss that occurs is normally happening because of loss of fat in the face. And unfortunately, as we get older and we gain the fat distribution in our body, is a little cruel, because we get fatter in areas where we don't want the fat, and we actually start to lose fat in our face where we want to keep the fat. So what we can do is we can take the fat from areas in your body where you don't want the fat, and we can use that fat to restore the volume in your face, where we can get a very natural looking rejuvenation of your face. So there's areas in your face where we typically lose fat that make you look older. Typical areas are under the eyes, in the temples, in the nasolabial folds, those parenthesis lines, around the chin, around the jowls. So we have to do this strategically. Otherwise, you can look abnormal for sure. And the fat is a long-term treatment. So the fat that we transfer to your face will stay with you for the rest of your life because it's actual living tissue that we're transferring. So when you have this done, a couple of things. One, you want to make sure you have this done by somebody who has a lot of experience doing it. You want to make sure that the person that is doing the fat is processing the fat correctly. What we do is we use fat that has been broken up to almost individual cells, because if you put clumps of fat that you would get from a regular liposuction and inject it into your face, you're going to get lumps, you're going to get areas that look uneven. So we have to do this very precisely, and we do this using micro cannulas, almost like using fillers, but we're using larger amounts, and we're putting it strategically, so we don't put it all in the cheeks and make you look like abnormal, like some of the pictures that you see on the internet. And what we do is we don't try to overfill. Okay, the mistake a lot of doctors make when they do fat is that they believe that a lot of the fat is going to go away. So they overfill, anticipating that they're going to lose up to half the fat that they put in. And that myth is because in the past, when people used to put globs of fat in the face, it only makes sense that the central part, the middle of that fat glob that they injected into your face, is not going to get a blood supply, it's not going to get the nutrition. So the middle part of the fat will actually die from starvation, and only the fat cells around the outside of that glob would survive, so that the fat would collapse. And that's why people used to get the fat transfer and most of it would go away. So the way that we do it is we break it up so that there's no globs. They're individual, almost individual cells, or small clusters of cells that flow very nicely through a very small micro cannula that we use to inject it. And we inject it very strategically so that it does not look like it's overdone. And in fact, I like to do it in multiple treatments. So in this picture, you can see that the middle picture is after the first treatment, and you can see she has a significant improvement. But she wanted to do a little more. So about 6 months later, we went ahead and did another treatment to further improve the outcome. And this is going to stay with her. And now she's going to age, and she might need to top it off in a few years with a little more fat. Or since she has a base, we can actually use fillers to touch it off, because unlike the fillers that go away after 6 months to a year, the fat is there indefinitely. And you may need to just top it off. But what we have there, she's not going to lose. So this is my favorite treatment, and this is what we're really known for. This is what people kind of come from all over to have done. So finally, I wanted to talk to you about some really, really exciting things that are right around the corner in the future. Actually, it's happening right now, because it turns out that your fat is loaded with adult stem cells. And unlike fetal stem cells, these are cells that come from your own body, and they're found in the fat. So when we do liposuction, we're actually pulling out all these stem cells from the fat, and we have the technology right now in our office to extract these stem cells and use it for a variety of regenerative treatments. Unfortunately, because of regulatory issues with the FDA, we cannot offer stem cell treatments for medical treatments at this time. But this is something that will be available hopefully in the very near future, for all kinds of medical conditions. But what we are doing is we're using these cells for aesthetic treatments, things like for improving your skin, for improving your hair growth. We use this to help with the wound healing when we do our procedure. So there are a lot of things that we can do with this right now, and be happy to talk to you about it if you're interested in it. And hopefully we'll be able to use these cells to treat medical conditions that that traditional medicine just doesn't have a good treatment for. But that's something that we will be talking to you about in the very near future. But this is really exciting stuff, and I'm so privileged to be able to do these type of treatments for you. And for the time being, we can certainly offer you our aesthetics treatments that we can do by removing, reshaping, replacing the fat from your own body. I am Dr. William Song from Omni Aesthetics. Thank you so much for listening. And if you'd like to find out any more information about what we do, please call us at 201-368-3800 or go to debulkdefine.com for more information on outpatient liposuction at Omni Aesthetics. We look forward to hearing from you very soon. Take care.